welcome to part 2 of the top 6 health concerns for men in honor of Men's Health Month. If you haven't watched part 1, make sure you do that after watching this one. So let's go ahead and get into the 4th health concern for men, starting with colorectal cancer. So colorectal cancer, or colorectal, is a collective term that includes both colon and rectal cancer, and is the second leading cause of death among American men and women. The American Society recommends screenings for colorectal cancer beginning at the age of 45 for men. Some of the risk factors for colorectal cancer include being, in most cases, over 40. Anyone that has a family history of colorectal cancer should definitely be screened earlier, or if you've already had a bout with cancer, because that increases your risk of having it again. If you've experienced inflammatory bowel disease, if you're drinking more than 2 alcoholic drinks per day, if you're overweight or obese, if you're smoking, if you have diabetes, or you are intaking a high-fat diet or a high-processed diet. Thankfully, colorectal cancer is usually preventable with screenings, and options for screenings include the stool-based test and the colonoscopy, which I'm sure everyone is familiar with. All right, the 5th health concern for men is hypertension and cholesterol. Now, the risk for hypertension or high blood pressure does increase with age, but would you believe that 1 in 3 Americans have high blood pressure? In fact, over half of all Americans age 60 or over have it, and will have it over a lifetime, and the risk of developing high blood pressure basically becomes 90%, which is insane. Do you know somebody that has high blood pressure? I'm pretty sure you know someone who has high blood pressure. And the risk in men increases with age and begins to climb with men at the age of 45. High blood pressure is especially dangerous because people can have it for years without even knowing it, which is why regular screenings are so important. Some of the risk factors for high blood pressure include a high salt diet, low potassium, too much alcohol, a lack of physical activity, obesity, and family history, all right? And also stress. We can't forget about stress, all right? And the screening is simple. It's not invasive. High blood pressure usually is diagnosed using the familiar blood pressure test that you put over the cuff around your upper arm. And the normal blood pressure is really considered to be anything below 120 over 80. And hypertension is defined as blood pressure of 130 over 80. Okay, so hypertension and cholesterol are highly linked, and so that's why I put them together in this one for number 5. So definitely make sure that you are getting tested for hypertension and cholesterol, okay? And cholesterol being very much needed in the body. It's needed to perform vital functions such as to produce hormones, vitamin D and the bile acids that help digest the fats in our body. However, too much is a bad thing. So there are 2 types of cholesterol, which I'm pretty sure everyone is familiar with. The LDL, which is the low density lipoprotein, and the HDL, which is the high density lipoprotein, all right? So LDL is responsible for blocking those arteries through buildup of fatty deposits called plaque, and this plaque can build up and block the blood flow to the heart muscle, reducing its oxygen supply, which leads to stroke and heart attack. HDL is the good cholesterol, which removes the LDL from the blood and eventually from the body. Now, here are some risk factors for high cholesterol: a diet in high saturated fats or processed foods, high in carbohydrates, overweight or obesity, or a lack of inactivity, okay? And annual blood tests will screen for high cholesterol and really should be started at the age of 35. All right, last but certainly not least is diabetes. Did you know men actually develop diabetes slightly more than women do? In fact, according to the CDC, 14% of men in the United States have been diagnosed with diabetes compared to 11% of women. General symptoms of pre-diabetes include skin infections that don't heal, excessive tiredness, poor mental health or poor dental health, inability to attain an erection, like erectile dysfunction, an overactive bladder, or blurred vision. And, men usually don't seek attention until they have full-blown diabetes. This is a huge, huge, huge mistake because early detection and lifestyle changes can make it so much easier and quicker to reverse prediabetes. The American Diabetes Association recommends all patients undergo diabetes screening at 3-year intervals beginning at 45, especially people who are overweight and obese, which is almost half of our society. And when multiple risk factors are present, screening should be done at an early age and more frequently. And the test for that is typically a fasting glucose test, is used for the screening for diabetes. So after all of that, so we've done with number 6, here's a quick overview of, the screening tests for men and when they need them. So prostate cancer starting at 50, colorectal cancer starting at 45, high blood pressure starting at 35, and cholesterol starting at 35 as well, with diabetes screening at 3-year intervals beginning at 45. Okay, so as you can see, poor lifestyle factors such as smoking, poor diet, unhealthy weight, inactivity, alcohol abuse, stress, these are all linked to increased risk of being diagnosed with a chronic disease or illness. Suicide is also another leading men's health risk, which is attributed to depression, which unfortunately a lot of men don't feel comfortable or like to talk about. So if you or someone has been feeling like sad or worthless and loss of interest in the normal activities, please seek help right away or speak to someone because that's a really important factor in men's health as well. But the good news is that many of these risk factors associated with these negative health outcomes are preventable and manageable through lifestyle and behavioral changes, which is what I do with JENuine Nutrition. So I hope this helps shed light on the top health concerns for men and really encourages you or your loved ones to take action because we need you men in our lives, okay? So happy Father's Day to all the fathers out there. And like I always say, the best investment in yourself is an investment in your health, okay? So that's it for today. Thank you so much for watching. Don't forget to like and subscribe, and I will see you next time.